Hey everyone, welcome back. So this week we have a muscle for kind of the deep core of the pelvis and the hip. We're primarily concerned with obturator internus here. This muscle, you can see this muscle kind of takes a 90-degree angle turn before it comes out over that lesser sciatic notch there and then attaches to the back of the hip bone. So if I'm going to show this, from the model, we're basically talking about this bone right here on the inside, and then this bone comes up out through the backside over this notch right here, and then comes over and attaches to this to the greater trochanter of the femur, this bony prominence on the outside of the hip. And this muscle is responsible for externally rotating the hip. So if we're looking at this from the front, that your femur, your thigh, is going outward as a result of pretty much all of these muscles right here: piriformis, superior inferior gemellus, obturator internus, obturator externus. What makes this particular muscle so special is that 90-degree angle right there, and it also, you can see it dives down deep, deep, deep inside of the pelvis and actually makes up part of the pelvic floor. So there are deep considerations here, not only for hip external rotation, if you're missing some of that, but also if this muscle is weak, it refers pain to the tailbone. So people with sacroiliac joint pain, it also makes up a good portion of the pelvic floor. So you could have pelvic floor issues if there is weakness or dysfunction here. So we're going to take a look at Dr. Hannah, and she is going to show us how to perform this exercise. All right, getting into this exercise, what you'll notice initially is that Dr. Hannah's head and neck are fully supported with one hand. On the other hand is at the top of her hip, kind of monitoring those obliques and those abs. So breathing is a part of this. Right? When we're talking about lumbopelvic function and we're talking about core stability, we have to pull the breath in. Breath has to be a part of this. So you'll also notice that this lower leg here, this is where we're working on that obturator internus muscle. Her hip is at 90 degrees and her knee is at 90 degrees. That hip being at 90 degrees helps us isolate that obturator internus muscle as it works on the external rotation of the hip. So now, as with any external rotation exercise, you want to breathe in as the foot comes up. So exhale, breathe in, inhale, exhale, inhale. Long, slow inhale through the nose. And then when you sigh that air out, when you're breathing out, you want to monitor those obliques. See if you can pull those obliques in a little bit, monitoring those side abs, again, kind of reinforcing core activation, core stability of the lumbopelvic complex while we're working on strengthening this muscle. So if you have any questions, please reach out to us, especially reach out to Dr. Hannah. She'll have a lot more for you on this. I hope that was helpful. We will see you here again next week.